Hello and welcome to NorthBay Healthcare's COVID-19 chat with Dr. Seth Kaufman. He's the Chief Medical Officer at NorthBay and an emergency room doctor. And with that, I'll just hand it over to you, Dr. Kaufman.
Thanks, Robin. Good morning, everybody. I hope you're having a safe and healthy day. It feels great to have some cleaner air right now. So with that, we are going to start as we do every 2 weeks. I'm going to go over some of the numbers in Solano County. I'm going to talk a little about our county risk level. And then the hot topic for today's introduction is vaccines. There's been a lot of headlines about vaccines. We're going to talk about the kind of latest updates around vaccination, COVID vaccines, although flu is very important too. And then we'll go right into your questions. So thanks for joining. So let's start with the numbers. We are doing very well. So is the state. We're really seeing a downward trend right now in California. And Solano County is no exception to that. We currently have a 7-day positivity rate in Solano County of 3.1%. There's currently 29 as of yesterday afternoon when the county public website was updated. There are 29 hospitalized patients in Solano County. That is down from numbers like 40s, high 30s, if not higher than that, a month or two ago. Total confirmed cases is just over 6,000, so 6,007, and we have a total of 52 deaths. There has been a recent increase in deaths, but overall we are seeing a downward trend. Our current risk level defined by the state, there are categories defined by the state: purple, red, orange, and yellow. We are in the purple with most of the state. Now, in the last few weeks, some counties have made it to red. San Francisco is a good example of that. And remember, with each risk level, you get to reopen businesses. I think that's what's most important to us. There's also some other loosening of restrictions around schools. And so we remain in the widespread or most restrictive risk level. But our data actually shows that we are heading towards red. You need to be in the next risk level. The numbers need to be in the next risk level for 2 weeks over a 3-week period to be considered to be allowed to be permitted to drop down to a better risk level and reopen businesses. If we do get into the red, it means that many businesses that currently are not open may be able to be open with limited capacity. A lot of them have a 25% capacity. Gyms are an example, and other businesses. So for the last week or two, especially with that 3.1 positivity rate, the two things, there's other factors too, but the big two things the state is looking at is how many cases we have per 100,000 people and our positivity rate. So for everybody we test, how many turn positive. And so being in the, if we've been under 7, which puts us way into the red level, actually puts us in the orange level for a good week, or longer. And our case rates, less than 8, sorry, and our case rates also need to be, around less 7 or less per 100,000, which means for our population, low 30s. We need to be under the low 30s for several weeks to be considered in the red, and we have been, but really only for the last week or so. So in our regular county call this week with our public health department, the discussion was that next week we may, if our numbers stay where they are and there's no major impact from Labor Day, we may see that we're permitted to reopen some businesses and drop down to that substantial or red category level. Okay, so that is the update with the numbers. By the way, NorthBay is seeing very similar numbers. We've got a drop in our hospitalized patients. We definitely feel like the impact of COVID on our healthcare system has been decreasing, trending downwards for the last month or over that. We are all concerned about whether the Labor Day weekend will cause a spike in cases. Remember, it's a delay. The incubation period for this disease is longer than other diseases. People slowly get sick. So it takes a good week or two or longer for us to see the impact of things like Labor Day. So we will see. In our next chat in 2 weeks, I will update you on whether Labor Day had an impact on the COVID levels at NorthBay. The hot topic for my introduction today, vaccine. So I'm going to try to boil it down. There's a lot of headlines out there. I'm going to try to boil it down to the most important points right now, and then we'll go right into your questions. There are 3 phase 3 trials for vaccines, COVID vaccines, in the United States right now. And I think there's a lot of promise for those. And there are some preliminary data before that showing that if you get some form of COVID, that you do have some sustained immune response. So there's a lot of hope that the vaccine will work. I will tell you, and I'm not an immunologist, but immunologists, one of their big mantras is that we don't really know if a vaccine works until we try it. So all these studies and data are helpful. We're not going to really know until enough time has gone by and we've used the vaccine and we see if it's effective. The NIAID, so our National Institute of Allergy and Infectious Disease under Dr. Fauci, is going to be assessing their like subcommittee on vaccines. Their board will be assessing and deciding what to do with 2 of the 3 companies that are making vaccines in October. That's going to be a major discussion, and they will decide at that stage whether these vaccines are safe enough and effective enough to be distributed. They might say, we don't see enough effectiveness here, or we're concerned about the safety, continue with the trial, go back to the drawing board and think about different types of vaccines. They might say there's so much benefit and there's so much need right now, and the safety profile is adequate. You can stop your study, apply to the FDA for an EUA, and take your vaccine to market. In other words, distribute it. So that may happen in October. I'm going to tell you though, and independent of your political views, doesn't matter who you're voting for, I think we all would agree that politics is not more important than the science and the safety of our COVID health efforts, including our vaccine development. And we should all keep that in mind. Again, independent of who you're voting for, we do not want a vaccine going to market, being distributed, that's neither effective nor has a safety profile that's not vetted enough to really be reliable, just so that politicians, any of our politicians, can talk about it on their campaign trail and deny the election. So I think we all agree with that. You do not want an unsafe vaccine. You do not want a vaccine that's useless, that you're getting in line for. So that is really important. My other comment is that, keep in mind, and I think most people watching this have read the headlines like I have, the logistics of distributing a vaccine is very challenging, and it's extra challenging in this situation. It's a worldwide, pandemic, so that's a challenge. It's something that most of us have never dealt with before. But on top of it, 2 of these 3 vaccines that are being developed in the U.S. require a super extra cold freezer, like something most systems don't even have. Like, we're going to need those. It's not just send it out to all the clinics out there and they'll just throw it in their refrigerator and administer it. So that's like a challenge in itself. And then it is 2 doses of vaccine over a month period, or more or less, somewhere around there, depending on which vaccine we're talking about. So 2 doses, a super cold freezer. This is going to be a challenge and something we'll deal with. We will deal with it, and we'll get people their vaccine if it's effective, but just know it's not going to be easy. Everyone needs to understand that the vaccine is not going to be 100% effective. This is not going to be like when you got a polio vaccine as a child and you just lived your life out saying, I'm not worried about getting polio. It's going to likely be more on the side of a flu vaccine or something like it, or maybe not even as good, where we don't know if it's going to be completely protective. It might be partially protective. We don't know that, and we should be realistic about the impact. So be prepared. It's not going to you get your vaccine twice over a month after it's in some crazy cold freezer, and now you're not worried at all about getting COVID. That's not how it's going to work. The CDC put out a playbook recently talking about how they would imagine priority groups and distribution. It's a very long document. It's really for the states to digest, and it's slowly trickling down to the county and will trickle down to the healthcare systems as we prepare for the potential of an effective vaccine distribution. And A lot of it talks about priority groups. I get a lot of questions about who the priority group's going to be. We don't know at this stage. I know NorthBay and other systems are going to be looking for guidance from our county and from our state health departments on how we should effectively distribute the vaccine, what we're watching for. It'll be, there'll be a structure from our county and from our state. But we can all imagine what those priority groups will be. Healthcare workers would definitely are very high on the list. It's in that CDC playbook. Vulnerable populations, other essential workers, right, who are just critical. If you're bringing food to the markets, we all need food, right? So there's such critical essential workers that if we have an effective vaccine, should be vaccinated, right? So, and I think some of the comments we've seen out there, if you're a healthy young person without any immunocompromising diseases, and you don't work in healthcare or you're not an essential worker, you shouldn't expect that you'll be getting a vaccine anytime soon. And that's not a bad comment. I think we should, we're going to be using it for people that are serving you, and I think that's what I expect will come out. So some of the comments about that population shouldn't expect a vaccine until next summer. It will be a long process, right? So even if there's a safe vaccine in November, December, it's not going to be like the whole world's vaccinated by January. I think we all know that. My last comment is about mask wearing around vaccines. There was a comment made by the CDC director around stating, something around that the mask wearing could be as effective or more effective than the vaccine. And I'm just going to add one comment to that, and that is that there are some studies, recent studies, showing that those who wear masks and are unlucky to still get COVID, generally will have less symptoms or no symptoms at all, compared to those whose compliance with mask wearing was not very good, or just knew where they got it. They're like, oh, I wasn't wearing a mask, I was at a party and somebody had COVID and I got it from them, versus someone who was very good about wearing masks. So I'm going to say that again. Those who wear masks in general and get COVID have less chance of having severe symptoms and have a much higher chance of having no symptoms. It's intuitive to me, right? You need to get enough virus in your mouth and nose to get the disease. It's not just like one little virus jumps in your mouth or one, the CDC guidelines really talk about how there needs to be kind of a prolonged exposure. So you need to be in front of that person, really, it has to really get in there. So if you're wearing a mask, you're probably getting less inoculum, less disease, less virus in your nose and mouth. You're going to have less symptoms, or you may not have any symptoms at all. But you might grow immunity from that, right? We don't know completely yet. So I'm saying that to you because mask wearing is really effective. And now it's not only effective at not spreading the illness around, the virus around, but also if you're unlucky to get the disease, you're going to have, chances are you'll have less severe symptoms or no symptoms at all. So mask wearing, really effective. And I agree that as we're talking about getting a vaccine out, we got to keep talking about wearing masks. Okay, right. That is my summary. Robin, we got some questions. I can see it in your hands. You have some papers in your hands. What do we have?
Well, someone's asking, there were some trials that started in Britain that got stopped.
Yes.
It had setbacks. Have there been any setbacks in the U.S. vaccine trials that you know
I see. Of? Yes. I'm not aware of any significant pauses in the U.S. trials. There is that case where someone had transverse myelitis, like a severe neurologic reaction, and I don't know more than that, but the trial was able to restart, and that was a single situation to my knowledge, but no significant setbacks is my understanding.
Okay. Will children be required to get vaccinated to return to school? Have they said?
Oh my gosh, that's a really good question. That goes back to my comment, and that's a great question. Will children be required to be vaccinated to return to school? I don't know that answer. I think it goes back to priority groups mandating or strongly recommending recommendation for vaccines. I don't think we know yet how that will be laid out. In my discussions with our leaders, our healthcare leaders, at this stage we're really waiting for more state and county guidance on next steps with this, and I don't think we know that answer. It's a really good question, and if I learn more, I will talk about it on this chat.
Okay. Someone's asking, how long does it take for your sense of smell to return after you've had COVID?
Oh, that's a great question. It's variable. So the question is, how long does it take for your sense of taste and smell to return? It's very variable. It could be weeks, and there are some cases where it takes months. It's weeks, but there's cases where it takes months.
Okay. So the flu season is upon us. Why is it more important than ever to get your flu shot?
Sure. That's a great question. So we didn't talk, I've talked about COVID vaccines in the introduction. I can't reiterate that we do have a vaccine out there that's really effective at preventing you from getting sick, period, from the flu, and that is the flu vaccine. So we should all be getting flu vaccines right now. Why is it so important this year? And the answer is that it'll be very hard to decipher. It is very hard to decipher. We already know this. Decipher COVID from flu. I get a lot of questions about this. Does my cough sound like flu or like COVID? Here's my symptoms. Is it flu or COVID? I don't know. And I know a lot about both those illnesses. Very hard without very specific symptoms. Most symptoms between flu and COVID overlap a lot. So the answer is it's really important this year because we don't want just more sick people out there. We have enough to deal with the COVID pandemic. We would love to avoid a bad flu epidemic, and realize that if you get the flu, that means we're pretty much COVID testing you, right? And will there be enough COVID tests to go around? Will the turnaround time be adequate? Will the tests be good enough? There's been amazing developments in COVID testing in the last few months, amazing. But the reality is it's still best just not to get sick with flu or COVID, so we don't have to worry about which one you have and get you tested for both. With that, though, I'll tell you that we at NorthBay and the other healthcare systems and our public health departments are preparing for this dual pandemic of flu and COVID. If it doesn't happen, wonderful, but we should be prepared. So we are preparing with availability of testing for both, right? We are absolutely spreading, creating a lot of opportunity for people to get flu vaccines. So we are expanding our respiratory clinics and availability of urgent care and things like that to make sure that if there is a increase in coughs from flu or COVID, that you are seen in a timely fashion, that video is available to you, and that testing is available to you. So we are preparing for all that, but hey, we won't need any of that if we all get flu vaccines and we continue to wear masks.
And what about hand hygiene and that sort of thing? Are you hopeful that people trying to avoid COVID are going to help bring the flu problem down too?
Right, so I'm going to that's a great question, the current transmission prevention precautions for COVID also work for flu. Hand hygiene, physical distancing, social distancing, and mask wearing. When this all started in February or January or December, depending on where you lived, we were in the middle of flu season. Flu season just dropped. It just dropped off. The minute we went into shelter in place, the minute there was adequate adoption of these prevention strategies. So if we all do hand hygiene, we respect the social distancing, and we do our best to wear masks absolutely all the time, there will not be a big flu season. There just won't be. Remember, flu is less contagious than COVID. Flu is less contagious than COVID.
Right.
These are great questions.
Is there anything new in terms of treatment? We've talked in the past about some of the drugs we use and plasma. Is there anything new coming down the pipeline? So
the question is, any new treatments? There have not been, just reinforcement of our current treatments. Convalescent plasma, dexamethasone especially showing more and more promise. Remdesivir still showing some promise, and and definitely nothing from hydrochloroquine. So there are no new medications that I'm aware of. We continue with our current strategies, and they're being effective. Death rates are dropping. We are seeing lower and lower death rates. People are getting out of the hospital quicker. We are getting patients better, quicker, faster. So I think we are doing a good job, and with the medications we have, and a reminder to everybody that this pandemic, it's only been a very short amount of time. We've learned so much, and we've been able to develop treatments so quickly, faster than any time in the past. So no new developments, no new medications as of now.
Okay. Kathy's asking, I hear people talk about quarantine and social distancing in the past tense. Aren't we still in the thick of it?
Oh, yes. Thanks, Kathy. So the question is people are talking about quarantine and distancing in the past tense. I'm not sure where that's coming from. It could be a few things. One is, gosh, we're all getting tired, aren't we, of this? I know I am, and I'm an advocate for everything that's happening out there, but it's tiring, right? It's exhausting. And if you were part of the, I think everybody watching, likely, if you live near me, you've been dealing with the wildfires. So we're all very tired. We're all very tired. But the reality is nothing has changed. The other reason might be that things are improving. Things are probably improving because of all these measures, quarantining, social distancing. We need to keep doing it. I'm going to take that opportunity. I'm not looking at the time, but do I still have time? I'm still good, all right?
10 minutes.
Great. I'm going to take this opportunity, based on that question, to quote a study that was recently published through the CDC. There was a study showing that those who do in-restaurant dining have a higher risk of getting COVID. That in-restaurant dining is a real risk. I hate saying that. I think our restaurants have had like others, like salons and all the businesses out there that are really have to have close contact, have had a real challenge staying afloat. It's really hard. And I think even if we move to the red zone in the next week or two, or the orange, as we start reopening, being told you can open at 25% capacity, it's going to be hard. It's really hard on our small businesses and even our bigger chains. But there are studies showing that if you're eating close together, which of course you can't wear a mask when you're eating, that you run the risk of a higher risk of getting COVID. Does that mean that restaurants can't function? I'm absolutely not saying that. Our restaurants are doing their best. The key is spacing tables out, right? All the compliance measures around hygiene. So I'm in no way saying that we can't function in COVID without, that we can't have restaurants in the middle with COVID. We just have to be extra diligent on spacing, on mask wearing, and hopefully outdoor dining will be okay, right? So those are the kind of things we have to look at, but not that it means that as we continue through this COVID pandemic that we can't have any restaurant services. So we'll have to see it, but we have to be extra diligent. I'm saying that because I know around my circles, people just really want to eat together. It's really important. It's part of our culture. It's who we are. We want to eat and talk, but it's a real risk. It's a real risk.
Are you seeing any difference in the acuity of hospital COVID patients? Do most require a ventilator or not? Good
question. Are we seeing a change in the severity of illness? So how sick people are from COVID? And the answer is that we, over early summer, we really saw a spike in the increase of sicker patients. And for us, we have a dedicated COVID unit on the floor, as in, I'm using medical terminology, in our inpatient units that are not the ICU, that are kind of our inpatient units, and we also have an intensive care unit dedicated area that's closed off when we need it. And so that's a good measure. You can't go on a ventilator to our normal floor. You have to be in the intensive care unit. So looking at the ratios of those, a way to know how sick our overall population is. And a few months ago, we had very high intensive care unit populations with a lot of ventilated patients and less in our floors. In the last month, it's been absolutely switched around. Very few of our patients are requiring ventilators. The majority have been doing just fine on a little bit of oxygen, maybe a little more oxygen in our regular inpatient units. Why, Dr. Kaufman? It's hard to know on this. I want to say that we're wearing more masks around and maybe people aren't getting as sick from it. We also, I think, we've gotten very used to these prevention transmission precautions and people are being better and better. So even if you get it, going back to my earlier introductory comment about the study, looking at whether mask wearing causes less symptoms, I wonder if people are just not getting as sick from this because we're being so much better about transmission. Our treatments are better. There's nothing new for this month around treatments, but We know more and more that the earlier we give care for treatments for some of the medications, the better people do. So we are starting treatments early, and I think that's having an impact also. So that's my answer to that one.
Just to clarify, when you say not ICU, but in a unit, you don't mean they're mingling in with patients who don't have COVID. There's a special wing.
So we have both a wing on our normal non-intensive care unit floor dedicated just for COVID patients. We do not mingle anyone together. And our intensive care unit, if there's enough patients that we need to have it, we have a dedicated pod, a dedicated area also. And I know our other healthcare partners do also.
Great. So any advice on how we can safely be out and see people outside of our bubble?
Good question. So the question is I really want to see this friend or family member. I miss them. Pandemic has been so long, and there's no end in sight, really, for a while at least. How do I see these people? So we know that the highest risk is indoors with poor ventilation and no mask wearing. So the best thing you can do, and this is hard for me to say when, now the air in most areas is better now, so I could say it for this weekend, I guess, but I hope it holds, is that your backyard, an outdoor area, go for a walk, so you exercise, 6 feet apart, mask wearing is your best bet. It's your best bet, and I'm going to say it's fairly good. There's still a risk. It's pretty low. People, I think these headlines have died off a little bit, but there remain a lot of concerns around aerosolization. So whether the disease is just floating around after it gets released out of someone's mouth or nose and just kind of floating for a while. I remember there was a lot of concerns early in the pandemic whether someone would be jogging and release some, and then miles behind them would be somebody else and they would get it. That hasn't panned out. We know in healthcare environments when we're messing in people's mouth, or they're getting procedures or surgeries and they have to get tubes in their lungs or be put on oxygen, that is aerosolizing. It's kind of spreading the virus around, and so we of course have maximal PPE for that. But we don't, in everyday life, in the backyard, that's not how this is spread. This is spread by droplet mostly. It's falling on surfaces, it's falling on your face, it's getting in your mouth and nose, but it's falling. So my answer to you is outside, 6 feet apart, wearing a mask. Okay. And hang out with your friend or family member.
Is there any concern about shortage of treatment medications?
Oh, that's a great question. Is there any concern about shortage? Yes. Overall, yes. Right now, things seem to be okay. I'll tell you, with the exception that if you had COVID, and you'll see on the public health website, you should have received some instruction around this. We are always looking for plasma convalescent serum. So that means donating your blood, but we're really, we need your plasma, and they could separate that out so we could treat somebody else. It's a wonderful, good deed, by the way. So if you've recovered from COVID and you really want to help somebody, it's you're literally helping somebody else get through their COVID, and you went through it, so it's a wonderful way to do it. So I would say that it's being watched very closely. There is adequate medication for who needs it right now in Solano County, but this is constantly monitored by our county colleagues, by the state, by others. And please donate convalescent serum. Donate your blood for plasma if you can.
Great. We've got about 2 minutes, and I don't want to end without you talking a little bit about how safe it is to seek medical care at facilities.
Yep. So thank you, Robin. As we like to close with this sometimes, because we care about your health, we care about our community. So the question is around, what's happening at North Bay? Is it safe to come in North Bay? We at North Bay have been doing very, very well with the COVID pandemic. We have very strict protocols about visitors. We have very strict protocol for our staff, and it is very safe to come to NorthBay Healthcare. Whether you need emergency department care, whether you, I hope not, but whether you need to have hospital-based care, whether you need to go to the clinic, we both have video and on-site availability. I said at the beginning is as we enter this flu season, we will have more availability for kind of cough clinics, and most of those we're going to try to start with video, and then we'll have availability for testing and on-site evaluation, so you have your lungs listened to. So we have a whole set of services. In all those services, we are practicing, mask wearing, aggressive hand hygiene, separating out patients who possibly have COVID from those who don't have COVID. So it is very safe to come here. It's actually one of the safest places to come. I think there's concerns around, oh, well, there's COVID there, so it's not safe. But honestly, places that have COVID patients are extra diligent with all those prevention strategies. So our staff are safe, our patients are safe, and we hope if you need care, you'll come and get that care.
If you think you have COVID or you think somebody else does, any advice for how to
Sure.
get in to get the care?
Sure. So if you're part of NorthBay Healthcare, you should the first step is to call your doctor and make an appointment. If you're really, really sick from it, the ER is open to you, urgent care is open to you. If you just call your primary care doctor, they'll set up a video visit and talk through your symptoms with you. If you're part of another healthcare system, I know all of them are doing very similar things. They want you to reach out early on, call. If you don't want to seek healthcare, there remains it's on the county health website. We have testing centers that are run through our state, that are run through our county. They actually have capacity and availability right now. So you can easily get tested. I know I don't say that very often, but you can easily get tested right now if you want to be tested for COVID. Tell your friend or family member that is worried they have COVID, and that's how to do it. Thank you so much for joining us. We will see you in 2 weeks. Do we have a date in 2 weeks?
Not off the top of my
Well,
head. It'll be in October.
It is 2 Thursdays from now. We'll see you in 2 weeks.
October 1st.
October 1st. There you go. October 1st, first day of the month. We'll see you here at 10 a.m. Thank you for joining.
Thanks, everybody.